Hi friends, the pregnancy. You need to take a very balanced diet. As you know that around 2200 kilocalories are required for a pregnant woman. So instead of taking the three major diets, whole of the diet should be included into small multiple diets over full day over the 24 hours. For example, instead of taking the three diets, you can do as I am explaining here in the video into the multiple 8 times. As you wake up early in the morning, people have the urge to take some tea or the coffee. Here you should avoid taking the tea or coffee, and you must take 1 cup of milk. If you don't like the milk, then you can add some protein in it, or some you can say flavor in it, so that but it must be taken. And some of the women, when she wakes up early in the morning, and then they have nauseating feeling. If you have such type of nauseating feeling, you can take just 2 biscuits or the bread. That will help you to get rid of your nauseating feeling. Now, very early morning, I have said that you must take the 1 cup of milk, and after that, in during the breakfast. What breakfast you need to take? Breakfast should be just take 1 glass of milk, and you can take along with it like dalia or poha, or you can say the sandwich vegetable. And you should avoid taking tikkis and pakoras or in the samosas, etc. So you can take in the breakfast, you can take the chapati also, this 2 chapatis, or people who in the South India, they can take the idli, dosa, etc. with sambar, etc. Now, after the breakfast, you go for the mid morning. You can take the lassi or the soup or the fruit chaat. You need to eat a lot of fruits in whole of the day. Instead of going for fast food, you prefer the foods, because foods contain a lot of minerals, vitamins, etc., which is highly nutritious, as well as they provide good nutrition to your child, which is growing there in your uterus. And you can take the roasted chana or etc. Now comes to the lunch time. In lunch time, you need to take as in India people prefer the chapatis. You can take the chapatis and the rice. And rice should be avoided during the night time. Now, along with you can, if you are non-veg eater, you can take the non-veg, but it should not be. It should be very properly cooked. Uncooked meat should not be taken. You can eat the paneer, where paneer contain the protein, or you can say whole of the protein coverage that you need daily is 75 grams of protein you need. You can take the 1 katori of dal or the curd, along with good fibers in the form of salad. Now, the tea time, and as I said, you should avoid the tea or coffee. Take milk again with vegetable, with poha, or with you can say biscuit, etc. Now, evening time. In evening time, you take one fruit. For example, the evening time, for example, between the 6 to 7 p.m. and the tea time between the 4 to 5 p.m. So now comes to the dinner. Now come to the dinner. Dinner is same as that of the lunch, and now you can have some sweet like kheer, or some dessert, or like custard powder, etc. Now coming to the bedtime. Just half an hour before going to the sleep, you can take one more glass of milk. So now with this, you can also take the fruits. Now, the things that you should avoid in fruits are the papaya and the pineapple. Papaya are found to cause the abortion, so you must avoid that. And you can take other fruits like dates, like apples, etc. Those people who are the chronic smoker, they must avoid smoking, and you should never take alcohol. Artificial sweeteners should be avoided, and those people who are in the habit of drinking the coke or just this cold drink, they must be avoided. Food that you have prepared and which has been kept in the fridge for 2 or 3 days, or even for 24 hours, that should be avoided. Very cold food should not be taken. And the fishes which usually found from the ocean or the sea, they contain high amount of mercury and that should be avoided. So overall we can say that you need to have a good balanced diet. So this is how in the first trimester, the second trimester you can have these food stuff and can enjoy the pregnancy. Thank you for giving your valuable time.
इसमें फॉलिक एसिड के बारे में नहीं बोला आपने।